My name is Dr. Gene Rosenberg. Today I'm meeting with a patient of mine, Mr. Michael Walsh, and we're going to discuss his experience recently with the treatment of high-intensity focused ultrasound for prostate cancer. Mr. Walsh, why did you choose high-intensity focused ultrasound therapy for the prostate cancer?
Was diagnosed with the cancer, and then I had to make that decision, and I looked into actually you introduced me to cryo and the HIFU, and I had to make up my mind. I went out and I talked to some people about radiation, which I didn't think was a good procedure for me. The robotic, I've already had 2 surgeries on my stomach, and I don't want another one. The cryo, I was afraid of the nerve damage, so I decided on the HIFU because it would be the least invasive. I have a small business. I didn't want to miss too much time out, and it turned out to work out that I was back. It took 3 days to have the procedure done between travel and back. I was back to work that Tuesday after I got back, so I missed 1 day of work.
In describing your experience with the HIFU, when you woke up from the procedure, did you find that you were in a great deal of discomfort?
No, I had no pain at all that I can remember.
Okay. And were you comfortable with the doctors who were taking care of you in Nassau?
Yes. The HIFU people met with me the night before and explained to me everything that was going to happen the next morning. The next morning, I was treated professionally, and I met the anesthesiologist who explained the procedure that he was going to do. And that's it. Fell asleep, woke up, it was done.
Okay, so there wasn't much pain afterwards?
No, there was no pain afterwards. I had my dinner Sunday night, so I had no stomach problems or anything like that.
Okay, and was there any incontinence or leakage of urine?
No, very, very little, if any. I had the catheter for about 2.5 weeks, and then after that I started going naturally, and I've been fine since.
What about erections? Were they affected by this form of treatment?
Well, now they're not. I mean, right after the procedure, yeah, a little bit, and you put me on a low-dose Cialis, and I've been off that about 3 weeks, and things are working fine.
Wow, that's very nice. Was there any bleeding that you were aware of?
No bleeding at all.
And what happened to your PSA afterwards?
Right now, my last test was less than 0.01.
Wow, that's a great PSA. And if you had to, would you choose this form of therapy again?
Oh yes, definitely.
That's great. I'm very pleased.